Honorable Dr. Tanko Sununu features on the Big Agenda show with Prime Reporters. Honorable Sununu is the honorable member representing Shanga Zaki Federal Constituency of Kebbi State. Also, he is the chairman House Committee on Healthcare Service. The lawmaker spoke with Mercy Emilite, the host presenter with the Prime Reporters on the achievement and agenda of the Ninth House of Representatives, conducive working environment, and the need to increase hazard allowances for health workers. He also spoke on synergy and respect among health professionals in the country.
All we have to know that the activities of the National Assembly and for each chamber, either Senate or the House of Representatives, apart from the plenary, is conducted by the Standing Committee, which are saddled with responsibility of oversight, budgeting, and the rest for the particular MDA which is being oversighted by the committee. Not only that, at times you may have a need for an ad hoc committee that will work for a short period of time, and after completing its assignment is dissolved by the Speaker. The Committee of Healthcare Services oversight the Federal Ministry of Health and virtually all the regulatory bodies in Nigeria, healthcare wise. Those regulatory bodies include NAFDAC, National Health Insurance Scheme, Medical Athletic Council of Nigeria, Pharmacist Council of Nigeria, Nurse and Midwifery Council, and many other councils on board of this. The aim of those is to ensure that praxis is done according to the ethics of the profession, and is also responsible for final legislative activities of amendment of any act or establishment of any bill or anything that has to do with policy that require legislative backing. The committee, after first hearing and second hearing, will be given further legislative assignment to go and carry. And to this end, we have done so much in terms of our legislative activities. We have conducted many public hearings. Among them, the one that requires much attention was the infectious disease bill at the inception of the COVID-19 pandemic. I said it's important because it raised so many issues, and the aim of that bill is to see how we can control the spread of infectious diseases, chemical assault or whatever you have in the country from one area to another. Because we realized that the Quarantine Act as of that time was obsolete and it cannot address the current realities. But however, it raised a lot of issues. Some talk about human rights issues, rights, impeachment, which other than that. So we have to go into a very mega alliances and advocacy to harmonize our position with non-governmental organizations such as Yaga Africa, and many of them that were keen to ensure that all those issues were addressed. And incidentally, we are happy we were able to address such issues, and the bill has been passed. Senate just passed its one yesterday for concurrence. So we also thought of an issue that this country must have universal health coverage, and we realized that the major impediment is lack of legal framework that will allow for that, because the National Health Insurance Act that is currently operational did not give permission or the ability for the MDA to take care of everybody. So we have to amend the law to ensure that it is mandatory for everybody to have basic minimum packages. And a part of that, we also look at other sources of innovative financing of healthcare so that more money will be available to the pool of National Health Insurance Scheme so that it can render services to this thing. Not only that, the committee is also saddled with responsibility of budgeting. And in this regard, we have also performed wonderfully well. We have tried to address whatever is the interest of the source country at large. And this, I must say, we have we have a very good alliance and understanding with Federal Ministry of Health. For instance, at the onset of the pandemic, there was a provision in the Amendment Bill of 2020 which recommends that each and every state must have 3 molecular laboratory. That's one per senatorial district. But the provision for the funding was there, but no other logistic activities on who will be responsible in charge of that lab, who will man the lab, how will it operate? Was it going to be under federal government, state, or local government? That couldn't be defined. So, and the committee with other health care services committee of the National Assembly, we came together and we realized that the best way we have, since we have the fund, is to make a rational use by upgrading all the tertiary institution, hospitals, laboratories we have. And that's why now, if you go in virtually all federal medical centers and teaching hospitals, you see isolation center, you see molecular laboratories. So that we have done that to ensure that the money was judicially used, and we have a very good understanding with this. Not only that, we know that access to health has to do with human resources for health. And for human resources for health to be active, it must be functional on every day. So our first challenges when we came is to see how we can intervene and address a strike by health workers and doctors. We started with doctors. So many issues were basing in terms of their arrears and what have you, that is always called for the strike. So those issues, in alliance with the federal government, we have done a lot in trying to address those issues. However, I would just say up to now there are some gray areas that is being discussed, most especially the hazard allowance that is right now it is 5,000, and it is acceptable. Even the speaker made mention of it that it's unacceptable in Nigeria for you to have a hazard allowance of 5,000, which cannot even get you a complete dose of, let's say, even standard augmentin in the market, and you are exposed to so many infections. So for this, we have the Ministry of Labour and health workers unions and doctors are working together to see how they can come with acceptable this, because we also told the government side that whatever we are going to do, we make sure that we approve what is going to be affordable by the government. There is no point for you just because you want services to be restored. You append your signature on what you know deep inside you that the government cannot afford. That is a cause for further strike. So we have done that, and we have done a lot of oversight activities. We have gone even down to the lowest level of healthcare leaders, primary health center. I can remember I was in Kaduna State. I went to Makarfi primary health center, and I've gone to so many primary health centers just to ensure that services are restored. They are given, especially with intervention from members, because a lot of members join the program of National Health Insurance scheme that provide for an individual to pay premium for number of people that he can cover for so specific cases. A lot of members out of their constituency project enroll some of their constituency people to avail them of such services. So we do go there and oversight them. Well, nevertheless, to say that in the last 2-3 years that we have been in existence, everybody in the country really know that the committee is up and doing, is proactive, and we have done a lot in the discharging of our duty. But all this, the creative definitely must have to go to the speaker for giving us all the necessary backing to do what we are going to do, and he has been of supportive. At times, I just give him 3-4 hours notice of an emergency meeting to solve labor-related issues or health issues, and the speaker will oblige the request and will attend it physically. There was a time he sat down with us for almost 8 hours trying to resolve some labor issue. That is proactiveness and readiness to facilitate our activities, gingered us a lot to do more. And we promise that in the remaining period that remain, we'll ensure that a lot of things we are done to move this country forward health-wise.
Okay, that's quite interesting. Okay, now, sir, looking at the need to reform the health sector in Nigeria, which has been a major concern for the government, a task undertaken to improve the health and well-being of its population and to ensure sustainable development, Mr. President inaugurated a committee to undertake a review of all health reforms and adopted in the past 2 decades, chaired by the Vice President. You are a member of that committee, so tell us what it has been so far.
Well, as you made mention that definitely everybody in the country knew that the COVID-19 pandemic has opened not only Nigeria, worldwide, it has provided an avenue for countries to look and do a retrospective and then present the view of their health system. Is it really, does it have resiliency, or is it a fragile one? A system that has resiliency is the one that will be able to absorb shock. For example, now, if everything is going and suddenly you have an outbreak, can the system absorb it and curtail it without other services suffering? And then moreover, when the COVID came, it appears that our health system is fragile. All the countries are on their knees. So you understand. And here, added to that, there was also it also afforded opportunity for even those in the executive to go around and see for themselves the infrastructure we have, the human resource for health, our finances, and what have you. And it turns out to be definitely where we are cannot take us anywhere. And that is the wisdom behind which President Muhammad Buhari tried to set up the committee so that it can make a holistic review of challenges facing the current system and then profile a way forward so that we can address those challenges that in the near future, this country healthcare will be one of the systems that is all our world is proud of. If you go back to the lane of history, there was a time when even the Saudi monarch and a lot of them in the Saudi do come to university, college, hospital, Ibadan to secure their health when they are ill. But now it has become a reverse of it. People now going back to Saudi. And you now even see people going to Benin Republic and nearby areas to search for health. And that call that we should have to do something. Definitely the committee has been inaugurated, has been mentioned, but it's yet to commence activities. And I think very soon the Vice President will have time to address the issue. Because looking at where we are now, for the committee to work and within 6 months and get it implemented, it may round up its finding towards the late part of the last part of this regime. And that may not afford the period for implementation of most of the documentation. Because late for me is that whatever is the outcome of that investigation, the administration must be able to address 60% of it so that the next income regime will build on that and then we'll have 100% implementation. So I do hope that it will be this. And definitely there are a lot of issues. We just have to look at our financing. If you look at the financing in the country, as it is now, it's around 5-6%. But if you go back the lane, when the head of state of African countries came in Abuja, we have a Abuja declaration that suggested that each country must spend at least 15% of its consolidated revenue for healthcare financing in this country, so that we can improve on our domestic funding of health. But we are far from there. If you look at the infrastructure, we have a lot of infrastructural decay with a lot of instruments that are nearly obsolete. So, and then there is also non-prioritization of our healthcare delivery centers. We pay more attention to curative services rather than preventive services. And that's why you see when you go to our primary health centers, a lot of people will see the primary health center, but they walk away in front of the primary health center and go to Mercy Teaching Hospital to access treatment for common diseases that rightly belongs to primary health center. So we have to improve those infrastructures, the capacity, what have you, funding, so that at least we can generate confidence in people to go to primary health centers and get themselves treated. Once you do that, you now leave high ceiling researches to our institution of higher learning like the University Teaching Hospital so that can provide solution to continuous problem that is facing us. And then further issue even in healthcare delivery and even in our academic system, worst part of it that we must also address in this reform committee is the alignment between research institutions and implementation. You find that if you go to teaching hospital, they have done a lot of research that if applied will improve the health services delivery in the country. But there is no alignment between that research, the result of research, and the executive decision in making. So we want to see how those people can be, the two groups can marry together so that whatever is the outcome of a very good study in Ibadan can be implemented nationwide to improve healthcare services. Because that's the only way we can go ahead and improve this country. Otherwise, if you do research only for academic promotion, but not for healthcare promotion, then the aim of research is defeated. People can go to professoriate level. It's a very good research finding. But when you look at it, what is the impact of that research study to the society they belong to? It's almost zero because it has not been translated into actions. So these are also issues that we have to also look at in terms of this. Then we must also be able to address during that reform, what are the issues with welfare? Because as it is now, we just have like we're putting water in a basket. You understand? We are training, but number of those practicing is continuously going down because there are a lot of leakages. People are going out with brain drain. So you have to address what are the issues, Jamie, that will make those specialists in the country to stay. People will say salary. Yes, I think salary is one of it, but salary is not only one. Everybody wants to develop himself career academically wise. You need a very good instrument that can validate your research. So that whenever I say this is the result of research from Sokoto, from Mediguri, internationally it will be accepted because you have all necessary gadget to do confirmatory and to ensure that your finding is correct. And a lot of peer review worldwide supported your findings. So by the time we do that, you see people will now remain in the country to be researchers. Go to US, go to UK. Top, if you are to take each country, take 100 or 200 top 10 researchers in that country. I assure you will get 1 or 2, 3 Nigerians. And they are contented there not because of the discipline, because they have the ability to widen their thought. So these are all the issues that must also address. For the health reform also, though it may not, but we have direct and indirect causes of problems. We must be able to address security of life and property. Because if a health worker is not secure, his family are not secure, then definitely you will see where you are supposed to go to work, but you cannot go to work. And that's why even right now, if you go, you find that we have a lot of internal brain drain. Internal brain drain, some are external going out of the country. But if you leave Ibadan, you leave Ife or any other center, you are going out. Somebody who is based in Zamfara or Meduguri will likely move away from those insecure centers and move to Ibadan. And that causes also internal brain drain. So for us to get it better and ensure that every Nigerian has right to access to universal health coverage, the country must be secured. Thankfully, a lot of our effort is being done to secure the country. We do hope that in the next few weeks to months to come, we'll see the fruit of such effort of federal government.
Inshallah. Okay, sir, we are aware that you recently advocate for an advisory body for Nigerian medical professions where you identified challenges characterized by dwindling levels of discipline and respect for seniors and peers, gradual loss of goodwill, instant strike almost on yearly basis, widening relationship gap between elders and professional association, especially the NMA. Will this really curb the challenges, health worker strike and medical quacks?
Well, you see, the issue is that as a professional, I'm worried. The essence of why people should be a professional is to impact on the life positively. But when you find that if you call an endeavor a profession, it has its ethics. You must be satisfied you must have a certificate to enable you to be registered. You must have code of conduct. You must have respect for your elders. You must treat your younger one as your own. You should be able to encourage them, and they should also respect you, and many other things that are in the code of ethics. And that is how we brought up as medical students, and we grew to respect our elders. For example, that picture that I stood by, you can see that's my mentor, and I always see him as mentor. So such kind of people you want to, they are mentoring you. They have a specific discipline that you want them to impact on you, and they are also readily willing to impact it on you. For example, everybody knew when I came, even up to now, hardly 10. I can hardly reach 10 before coming to office, except for hold up and this thing, because that's the discipline of my trainer. You cannot come to office under Professor Kelly after 8 o'clock. He will not accept it. You must be there on time. And at times, he will be in the office by 6 o'clock to go around and personally supervise those who are around before that time. So these are the discipline. But I realize that over the time, these are going on. People can challenge their superior, not respect about this, and the strike is becoming so much. And I thought that the only way to address those issues is to see how can we gather elders to come together and make a review of our ethics, where we are, what are the challenges, and how do we move forward. Luckily for us, we have very big people, former ministers, and even the Emir of Shanga as part of those teams of elders. And we also have a very young, active, progressive person, Dr. Magashi, who's his own personal NGO, tried to ensure that it provide a lot of logistics that will address what is the need of that elders forum function. We have had several meetings and we have seen a lot of impact. They've gone through a lot of advocacy and they have interacted with NMA, they have interacted with Nigerian Association of Resident Doctors to see, yes, we quite believe that your calls are genuine. As elders, we also work together with you to see how we can address this. But they play a lot of role in bringing the last strike to an end. And they are still working to see that issues that were addressed by the MOU are achieved in the shortest possible time. And then they are also trying to see how they can liaise with the National Nigerian University Commission, Medical and Dental Council, who is also a member of that committee, to see how they can introduce curricula that will address ethical principles in medicine to an undergraduate before he comes out, so that you know that what is expected of you in terms of ethical conduct. Even in medicine, the mode of your dressing are very important. There are some dresses once you do, nobody will allow you to go to a sword round or enter a sword. So this issue must also be addressed so that at least we can have respect. You see, there is direct relationship between confidence you have in your doctor and healthcare advantage you drive. If you walk in somebody's room and all of a sudden you lost confidence that this is not a particular person from his mode of dressing or any, this is not the person I'm supposed to see. I'm sure after he has consulted you, you go out with that look, is he sure he knows what he's doing? So that psychology may affect even your rate of recovery. But they God, this is the person, this is the kind of doctor I want to see. You see, that feeling has already even addressed most of your problems. And you have the confidence to tell him what you cannot tell the initial doctor had mentioned. So this is what we are saying, and this is what we are the aim of that reason. And I must be grateful to the president of NNA, Professor Innocent Uja, for aligning with my thought and for all the elders that agree to participate in the 3 meetings we had, 2 in the Transcorp and 1 in the Chida Hotel. And we'll continue to do that, and we'll make sure that within the period of time we are given, we'll try to say that we have come. And then it's not also surprising because I was a past secretary general of Nigerian Medical Association. So I've known a lot of behaviors of doctors, and I know a lot of their listening. And you also mentioned it, the professional rivalry is one of the major issues that even as a secretary general, we try to work and address those interprofessional rivalry. Because we believe that working as team is very, very vital. Otherwise, once undermining the services of the other, the person that will be affected is the patient. So when you reduce the rivalry and you allow the teamwork, then you are addressing the all issues. And these are also the areas that must also be looked at by the Presidential Health Reform Committee, that at least we can find solution to issues that are militating against progress of healthcare delivery in the country.
As a chairman of this committee, have you done any medical outreach to your constituency?
Well, as a chairman of this committee, we want to say that not only medical outreach, I've done so much for my community. Community has benefited immensely because it has been my tradition even before coming to National Assembly to organize medical outreaches. But as a member of House of Representatives, I have organized medical outreaches almost 3 times now. We are preparing to go for the 4th time. And I think the total number of patients that benefited so far are more than 12,000 people.
Wow.
Not only that, I have other services that are healthcare related. I have outreach for cataract, which I came up with the problem of restoring 500 sites in 4 years. That's an average of 125 per annum. And so far, we have done 397 patients, gotten them operated, and their sight restored. And in the next few weeks to come, we are targeting to go for another, this time around 150 patients to benefit. Not only that, I also have a program for free cesarean section in my constituency. Any woman that has the cost to go for labor and she can't deliver on her own, or she need an emergency surgery for delivery, is done free of charge. I settle the cost of the surgery and I provide both medicine that will be used within the surgery and for at least 7 days after the surgery. That's how been done. And so far we have operated almost 988 patients. And not only that, of recent, because of the flooding we had in my constituency, the place is so much infested with a lot of snakes. We had an instances whereby in 1 month, we have about 15 to 20 people dying of snake bite. Wherever I go, my constituency complains to me, snake bite, snake bite. And the Genu epitaph, England, now you are going to use anti-snake venom. Epitaph anti-snake venom. In my constituency, if you had to buy it, it costs around 110 to 120 naira per buy. And you can see that's where we are even with premature ending of rainy season last year. A lot of people cannot afford it. So I took it upon myself to also provide it free of charge. And so far we have treated nearly 318 patients of snake bites. And to God be the glory, within the period we only lost 2 patients. Unlike before that, it's becoming a usual occurrence and people dying. And even right now, it's becoming a snake bite. No, that's not a problem. Take him to the hospital. Because initially they were not going because of the fear of raising funds. But now the medicine is free and readily available. Not only that, I also have a special outreach for the people with diabetes. Diabetes is becoming a serious issue nationwide now. And people cannot afford, because unlike before that I used to say it's the disease of the big men. Now that diabetes is a disease of virtually everybody, because everybody has tried to shift his food towards a big man like food. What I mean by it may not be as rich as that of big man, but people don't want to use fiber. They don't want to take vegetables, they don't want to exercise their body, everything. People will sit down chatting for almost 5-6 hours without moving anywhere. It means you are not using a lot of calorie, and that calorie will become a sugar. And if you are not sure, it's the only sugar possible, and one exhausts his insulin level in the body, and he becomes a diabetic patient. So we are providing them with education, we are providing to how they can monitor their blood level at home, and we provide each and every one of them with glucometer, and we provide them with drugs. Now take them at least 4 months and provide them with a recording book that they can normally do. And we told them, once you see a record below this, quickly go to hospital. When you develop this syndrome, quickly go to hospital. And then we also say that you must respect your clinic days. And sincerely speaking, all those that were recruited are well and moving about now, even though some of them along the line we miss them up. We are going to recruit more, and in the next few weeks we are also going for the 3rd or 4th camp of the diabetic outreach. And so much has also been done in other aspects. It's not only on health, because I'm a doctor. No. In education, I've renovated so many primary schools. I do provide scholarship support for every indigent of my constituency who is a postgraduate student, provided you are doing academic master's or PhD. Whatever aspect of it, whether you are working or you are not working, I provide you some support. And just some few lately in December, I introduced a scholarship for the female undergraduate, and I was able to give at least 400 plus students with scholarship, and they are still at this. And then I also realized that when I visited my son in the university, accommodation is a serious issue. So I have to provide. There are people who constructed hostels accommodation and are renting it out. So I've rented so many hostels for my students. I can say at least for now, I think I'm hosting almost nearly 1,000 students that are paying their accommodation. Just recently I paid for Wazir Umar Polytechnic. I've also paid that of Osman for the University. Sokoto, I paid for the Federal University, Borni Kebbi. What is remaining now is the Kebbi State University in Alawi that I'm going to settle this month. Not only that, provide jam forms, so many issues. That is health-wise. If you got empowerment, I've done several empowerment. Just December, I have done my third empowerment, and we have empowered almost 2,000 people. And we gave them something they can start business right from, with a lot of women and youth among them, with each one getting from minimum of 20,000 to almost those who have gotten 250,000. Just to ensure that we have empowered the people. And you know, my state is leading rice producer in the country. So I also have to provide farm implement, fertilizers, water pump, water blending machine, and so many issues. And we have also gone into skill to train youth to depend on their own. And most of them, some of them they have finished welding, some of them I buy all the necessary equipment and over to them and then give them some few people to train under them. So the whole aim is to see the essence of coming into politics, to see how can you touch the life of a common man, not how much can you make out of it. If you go, it's always joyful to be a politician, especially when you see you have addressed the issue of this. Like even the education, you want to understand in the whole of my constituency, they have 3 local governments. Up till now, we don't have a place where people can come and write a jam in the emirate. If they have to go for jam, they have to go to either Zulu, Constituency, or Kebbi. And I found that really unacceptable. As at today now, the construction of jam center, ICT center in my constituency has reached 90% completion. And in the 2020, we are going to furnish it with all necessary gadgets and computers that are allowed all the indigents to stay and do their distance, their jam, write their jam in Yahoo town. So these are some of the issues and this. And then say I must use this opportunity to thank All Progressive Congress for giving me the opportunity, because without party I cannot be here. And also to thank the people of my constituency that found me worthy to give me the trust, despite the fact that at the inception of my campaign, they've called on me to promise them what I can do, and I say I will not promise you. And the simple reason is I don't know what is available in my office. And that's why we always have a problem. Most people that will aspire to a particular office, they don't know what is available in that office. At times it's when you go, you find that the office is really indebted. You are trying to manage debt, and people are so looking for this thing. But frankly speaking, and let me say, in the last 2 years, so much was done. So much was done. Just in the last 2 weeks ago, in the last 2 weeks, I launched a particular book that I have put all what I have done in terms of education, healthcare, what have you. And it was really an interesting period. And I think that was in my life the only period I can recall that I could not address people because of a lot of commendation that people were saying, to the extent that I just have to burst into tears and then stop talking. So, and this is within the last 2.5 years. And so much was being done. And in fact, the emir commented as soon as that the editors decided to put it as a forward, that pictures don't lie. So, and this